The alar ligaments connect the superior lateral aspects of the dens with the medial aspect of the occipital condyles. Alar ligaments function to resist flexion, contralateral side bending, contralateral OA rotation, and anterior-posterior translation of the occiput on the atlas. Indications for this test include suspected instability of the alar ligaments, hypermobility, and screening of the cervical spine. Although there are no contraindications for this test found in the literature, it is suggested that the vertebral arteries be screened. The validity and reliability for this test have not been established, although Kale et al. Showed high specificity and moderate sensitivity.
But the patient is positioned in supine or sitting. The physical therapist can either stand or sit at the head of the patient. The physical therapist first palpates the C2 spinous process with their index finger and stabilizes to prevent rotation or side bending of the segment. Compression is then applied through the top of the head while slight passive side bending is performed. The physical therapist feels for the amount of motion to each alar ligament. It is recommended that this test be performed in 3 planes to account for any variability in alar ligament orientation, so the test would be performed in flexion, extension, and neutral biases. In the rotation stress test, a hand is placed on top of the patient's head, while another hand stabilizes the C2 spinous process using a lumbrical grip. Between 20 and 40 degrees of rotation is considered normal with this test. The expected outcomes of this test include a positive test exhibiting excessive movement in all 3 planes of testing and reproduction of symptoms. A negative test would exhibit no reproduction of symptoms and normal mobility.
I'm going to start out by feeling the right side of your neck. I'm going to push down the top of your head and then just slightly bend your head to the left. Any discomfort?
No.
Now I'm going to turn your head to the left. Any discomfort there?
No.
Okay, I can do that with your head also bent forward, bending you to the left, and then turning you to the left. And I can do it with your neck bent back, bending you, and then turning you. Any discomfort with any of those?
No.
Okay, now I'll test the left side. Feeling the left side as I bend your head to the right, and then turn your head to the right. Good. I can do the same thing with your head bent forward, bending it to the right, and turning it to the right, very slightly. And then the same thing with your head bent back. You can bend it to the right, and turn it to the right. Any discomfort with any of those?
No.
Okay, well you had normal mobility and no symptoms, so I would call that a negative test.